Have you ever woken up in the middle of the night gasping for air? Or noticed your ankles swelling for no reason? Maybe simple chores that used to be easy now leave you exhausted, and you're wondering if it's just getting older. If you're over 60, these could be subtle but serious warning signs that your heart is struggling. Today, I'm going to reveal 13 heart failure signals most people ignore, and understanding them could literally save your life. Stay with me, because what you learn in the next few minutes might be the most important health information you hear this year. Your body is constantly sending you signals, and when it comes to your heart, those signals can be subtle, easy to dismiss, but incredibly important. Over 60, it becomes even more crucial to pay attention to what your body is telling you because the risk of heart failure increases with age. Many people think that feeling a little more tired than usual, noticing some swelling in the feet or ankles, or getting out of breath after a short walk is just part of getting older, but these could actually be early warning signs of something more serious. Shortness of breath, for instance, is one of the most common signs, and it doesn't always come during exercise. Sometimes it happens when you're sitting quietly, watching TV, or even lying in bed, gasping for air without any apparent reason. That's your heart struggling to pump blood efficiently, causing fluid to back up into the lungs, and making it harder for your body to get the oxygen it needs. Fatigue that drains you despite adequate rest is another signal. It isn't the same as the occasional tiredness everyone feels. This kind of exhaustion makes routine activities like climbing stairs or carrying groceries feel like climbing a mountain, and it comes from your heart not supplying enough blood to your muscles and organs. Swelling in the lower extremities like your legs, ankles, and feet is easy to overlook because it can appear gradually, but it is a clear indication that fluid is accumulating due to poor circulation. A persistent cough or wheezing that isn't linked to a cold or allergies is another subtle clue, often ignored because it seems minor, but it points to fluid building up in the lungs. Even irregular heartbeats or palpitations, moments when your heart feels like it's fluttering or racing without explanation, are warning signs that your heart is under stress and struggling to maintain its normal rhythm. Sometimes, cognitive changes like mild confusion, forgetfulness, or difficulty concentrating appear, because your brain isn't receiving enough oxygenated blood. Sudden weight gain over a short period, often from fluid retention rather than diet, can signal that your heart isn't managing fluid properly. Loss of appetite or feeling nauseated can also be related, as congestion in the liver and digestive organs occurs when the heart isn't pumping effectively. Even feelings of dizziness or lightheadedness, particularly when standing up, can indicate that your heart is failing to maintain stable blood pressure. All of these signs may seem small or unrelated on their own, but together they form a pattern your body is trying to communicate, and paying attention to them early gives you the power to act before the situation becomes serious. Recognizing these warning signs requires honesty with yourself, taking note of changes you might have brushed off, and understanding that aging doesn't automatically mean these issues should be ignored. Being aware of your body's subtle cues allows you to reach out to healthcare professionals, get proper testing, and make lifestyle adjustments that support your heart. And it's this kind of vigilance that separates manageable health conditions from emergency situations. By tuning into the signals your body is sending, you're giving yourself the best chance to protect your heart, maintain your independence, and live a more active, fulfilling life well into your late. Years early detection of heart failure is one of the most powerful things you can do for your health, especially once you're over 60, because the earlier you recognize the signs, the more control you have over your outcome. Many people wait until symptoms become severe before seeking help, assuming that feeling tired, short of breath, or swollen is just a normal part of aging, but catching these warning signs early can prevent complications and even save your life. The truth is, heart failure doesn't happen overnight. It often develops gradually, giving your body time to send subtle signals that something is off, and those signals are opportunities for action if you pay attention. By noticing patterns like increased fatigue, fluid retention, irregular heartbeats, or a persistent cough, you can alert your doctor before the condition becomes serious. When medical professionals catch heart failure early, they can use diagnostic tools such as echocardiograms, EKGs, blood tests, and imaging to get a clear picture of how well your heart is pumping. And this allows them to create a treatment plan tailored to your needs. Acting early often means avoiding hospitalizations, preventing the heart from worsening and maintaining your independence for years longer than if the condition were ignored. Early detection also opens the door to lifestyle interventions that can make a real difference, such as adjusting your diet to reduce salt, adding low-impact exercise to strengthen your heart and circulation, managing blood pressure and cholesterol, and implementing strategies for stress reduction and better sleep. Each of these changes is far more effective when started before heart function declines too far. Another benefit of early recognition is that it allows you to notice how your body responds to interventions over time, giving you the chance to fine-tune medications, exercise, and daily routines in a way that works for your individual health profile. Family and friends can also play a role in early detection, noticing subtle changes you may not see yourself, like swelling in your legs, shortness of breath while resting, or episodes of confusion and dizziness, and bringing them to your attention before they escalate. Even small changes, like consistent daily weight tracking, noting activity tolerance, or logging unusual fatigue, become incredibly valuable when shared with your healthcare provider, because patterns emerge that can point to heart problems before they become emergencies. The key is not to wait until symptoms are unbearable, because by that point, the heart may already be under significant strain, making treatment more complex and recovery slower. Recognizing the combination of warning signs early, taking notes on changes, and seeking medical advice promptly gives you the ability to slow progression, improve quality of life, and make choices that support long-term health and activity. Early detection doesn't just mean catching a disease, it means empowering yourself to take control, to prevent unnecessary decline, and to make informed decisions that allow you to continue enjoying daily activities, social connections, and independence without letting heart failure dictate your life. By being proactive, you turn what could be a crisis into a manageable condition. Giving your heart and your life the best chance to stay strong, and vibrant lifestyle choices play a huge role in supporting heart health, especially after 60. And small, consistent habits can make a bigger difference than many people realize, because your heart responds directly to what you eat, how active you are, and how you manage stress. Diet is one of the most powerful tools at your disposal, and it doesn't have to be complicated. Reducing excess salt is key, because too much sodium causes your body to retain fluid, which puts extra strain on your heart and can worsen swelling in the legs, ankles, or even the lungs. Emphasizing fresh vegetables, fruits, whole grains, lean proteins, and healthy fats helps maintain healthy blood pressure and cholesterol levels, which directly reduces the workload on your heart. Staying hydrated is also important, but it should be balanced with your doctor's recommendations if fluid retention is already an issue. Exercise is another cornerstone of heart health, and it doesn't mean you have to run marathons or lift heavy weights. Low-impact activities like walking, swimming, cycling, or gentle yoga improve circulation, strengthen the heart muscle, and boost overall energy without overtaxing your system. Even small bouts of activity throughout the day, like taking the stairs, gardening, or stretching breaks, add up and help maintain cardiovascular function. Stress management is often overlooked, but can have a profound effect on your heart. Chronic stress triggers the release of hormones that increase heart rate and blood pressure, which over time can contribute to heart failure or worsen existing heart issues. Simple techniques like meditation, deep breathing, journaling, or spending time in nature can reduce stress and support overall heart function. Sleep is equally important because your body uses rest to repair and recharge, and poor sleep quality or insufficient sleep can raise blood pressure and strain your heart. Avoiding smoking and limiting alcohol are critical lifestyle decisions because both of these habits have direct, negative effects on cardiovascular health, increasing the risk of heart disease, fluid retention, and irregular heart rhythms. Weight management plays a supporting role too, because excess weight increases the burden on your heart, making it work harder to circulate blood efficiently. By combining all of these lifestyle factors, nutrition, exercise, stress reduction, quality sleep, avoiding harmful substances, and maintaining a healthy weight, you create an environment that supports heart function, improves energy, and reduces the risk of worsening symptoms. Importantly, these changes are not temporary fixes, they are lifelong habits that provide cumulative benefits over time. They also complement medical treatments if you're already dealing with heart issues, making medications more effective and recovery smoother. Lifestyle adjustments empower you to take control of your health rather than feeling at the mercy of age or genetics, and even small, consistent improvements can prevent serious complications, improve quality of life, and help you maintain independence and vitality well into your later years. By actively investing in your daily habits, you're not just reducing risk, you're strengthening your heart, boosting your energy, and setting yourself up to enjoy activities, relationships, and experiences without the limitations that heart problems can impose. Tracking and monitoring your health is one of the most practical and effective ways to catch heart problems early, especially as you get older, because the body often shows subtle signals before anything becomes serious, and being proactive gives you a huge advantage. One of the simplest yet most powerful tools you can use is daily weight tracking, because sudden changes in weight, particularly over a few days, can indicate fluid retention that may signal your heart isn't pumping efficiently. Even a few pounds gained seemingly overnight can be significant, and noticing this early allows you to adjust your diet, activity, or consult your doctor before it turns into a bigger problem. Paying attention to your daily energy levels is equally important, because persistent fatigue or reduced exercise tolerance is often one of the first signs that your heart is under strain. And keeping a simple journal of how you feel after different activities can reveal patterns you might otherwise ignore. Monitoring swelling in your legs, ankles, or feet can also provide early warnings. Check at the same time each day, look for changes compared to previous days, and note whether socks leave deeper impressions in the skin than usual, because these small details can signal fluid buildup. Breathing changes are another critical area to track, especially if you notice shortness of breath while at rest, waking up suddenly gasping for air, or having a persistent cough that doesn't improve. Keeping a record of these episodes can help your doctor assess the severity and progression of potential heart issues. Heart rate and rhythm are worth monitoring too. With wearable technology, or even simple periodic pulse checks, you can detect irregular heartbeats, palpitations, or unusually rapid heart rates, which are important signs of cardiac stress that shouldn't be ignored. Tracking medication adherence and responses is also part of monitoring your heart health. Noting when medications are taken, side effects, or how symptoms change over time allows you to provide accurate feedback to your healthcare provider and helps them make informed adjustments to your treatment plan. Beyond physical symptoms, cognitive and emotional changes deserve attention as well. Feeling more confused, forgetful, or lightheaded than usual can indicate that your brain isn't getting enough oxygen-rich blood, and recording these episodes helps paint a clearer picture of overall heart function. Consistency is key with monitoring, because isolated events may not seem significant, but patterns over days or weeks reveal trends that are critical for early intervention. Sharing your observations with a trusted family member or caregiver can provide extra insight, since they might notice subtle changes you overlook. And it also creates a support system for timely action. The goal of tracking and monitoring isn't to create anxiety, but to empower you with information so that you can act before small problems turn into emergencies. It's a proactive approach that complements medical care, giving your doctor concrete data to make better decisions and allowing you to make adjustments in lifestyle, activity, or habits based on what your body is telling you. By paying attention, recording changes, and noticing patterns in your weight, energy, swelling, breathing, heart rate, and mental clarity, you give yourself the ability to detect issues early. Seek medical guidance promptly and maintain a higher quality of life without letting heart problems sneak up on you taking action. And not waiting when it comes to heart health is one of the most important things you can do once you notice warning signs, especially over the age of 60, because every moment counts and delaying care can allow problems to progress to a point that is much harder to manage. It's natural to feel hesitant, to think that symptoms will go away on their own, or that feeling tired or short of breath is just part of getting older, but heart failure doesn't wait, and early intervention dramatically changes the outcome. Reaching out to your healthcare provider promptly is the first step, and it allows for proper evaluation through tests such as blood work, echocardiograms, or electrocardiograms that provide a clear understanding of your heart's function and any underlying issues. Acting early means your doctor can recommend treatments, lifestyle adjustments, and medications that prevent further deterioration, reduce fluid buildup, and improve your overall energy and quality of life. Following prescribed treatments consistently is just as important, because skipping medications or adjusting doses without guidance can undo the benefits of early detection and make the heart work even harder. Lifestyle changes, when combined with medical care, create a powerful effect, whether it's adopting a heart-healthy diet, exercising regularly, managing stress, or monitoring your weight and symptoms daily. Involving family and friends in your health journey is another critical aspect of taking action, because they can observe changes you might miss, encourage you to stick with your routines, and provide support when you need help with appointments, medication management, or lifestyle adjustments. Education is a form of action as well, understanding what your body is telling you, learning about heart failure symptoms, and knowing when to seek help gives you confidence and removes uncertainty that can sometimes delay decision-making. Taking action doesn't mean doing everything perfectly, but it does mean being consistent, being honest with yourself about how you feel, and responding quickly when you notice warning signs such as swelling, shortness of breath, unusual fatigue, or irregular heartbeats. It also means advocating for yourself in medical settings, asking questions, and making sure you understand your treatment plan so that you can follow it effectively. Early action often leads to better long-term outcomes, including fewer hospital visits, less progression of heart failure, and the ability to maintain independence and continue enjoying daily activities. Waiting or ignoring symptoms can lead to sudden complications that might require emergency care, and those situations are far more stressful, disruptive, and dangerous than addressing concerns proactively. Every step you take, scheduling a doctor's appointment, tracking symptoms, adjusting your diet, staying active, or following medication instructions is a form of empowerment. And it reinforces the idea that you are in control of your health journey, not just a passive observer. By being proactive, taking symptoms seriously, and acting immediately rather than delaying, you give yourself the best chance to slow the progression of heart failure, improve energy and quality of life, and protect your independence so that you can continue doing the things you love and living life on your own terms. And it's this mindset of prompt, consistent action that truly makes a difference in long-term heart health.